Nursing 474, Infectious Disease Prevention and Control. The weekly learning objectives include explain the current impact and threats of infectious diseases on society, explain the steps and principles that guide community health education, use evidence-based practice at multiple levels of the patient system, individual, family, aggregate, and community, choose evidence which will support community health initiatives, and prepare a comprehensive review of the literature associated with your identified problem. At the beginning of the 20th century, infectious diseases were the leading cause of death. By 2000, improvements in nutrition and sanitation, the discovery of antibiotics, and the development of vaccines had put an end to many of the epidemics. As individuals live longer, chronic diseases have replaced infectious diseases as the leading causes of death. Infectious diseases have no means vanished. They persist as the #1 cause of death worldwide. Pneumonia and influenza remain among the 10 leading causes of death. New strains test disease control abilities and consume resources. Previously unknown causal connections between infectious organisms and chronic disease have been recognized. New killers emerge and old familiar diseases take on different, more virulent characteristics. In the 21st century, infectious diseases have become a means of terrorism. Worldwide, infectious diseases are the leading killer of children and young adults and are responsible for half of all the deaths in developing countries. Because of the morbidity, mortality, and associated cost of infectious diseases, Healthy People 2020 lists a number of objectives for reducing the incidence of these illnesses, presenting varied, multiple, and complex challenges to all healthcare providers. Transmission of communicable diseases, agent, host, and environment. The transmission of communicable diseases depends on the successful interaction of the infectious agent with the host and the environment. These three factors are referred to as the epidemiological triangle. Changes in the characteristics of any of these three factors may result in disease transmission. Modes of transmission. Infectious diseases can be transmitted horizontally or vertically. Vertical transmission is passing the infection from parent to offspring via sperm, placenta, milk, or contact in the vaginal canal at birth. Horizontal transmission is a person-to-person spread of infection through one or more of the following routes: direct or indirect contact, common vehicle, airborne or vector-borne. Disease development. Exposure to an infectious agent does not always lead to an infection. An infection does not always lead to disease. Disease spectrum. The disease spectrum varies from a subclinical infection to a severe fatal disease. Endemic refers to the constant presence of a disease within a geographical area or population. Epidemic refers to the occurrence of a disease in a community or region in excess of the normal expectancy. Pandemic refers to an epidemic occurring worldwide and affecting large populations. Surveillance of communicable diseases. Surveillance is a system of close observation of all aspects of the occurrence and distribution of communicable disease through systematic collection, orderly consolidation and analysis, and prompt dissemination of all relevant data. Elements of surveillance are infectious disease surveillance incorporates and analyzes data from a variety of resources. Emerging infectious disease. Emergency infectious diseases are those in which the incidence has actually increased in the past 2 decades or has the potential to increase in the near future. These emerging diseases may include new or known infectious diseases. Example of emerging infectious diseases include Ebola virus, toxoplasmosis, tuberculosis, and West Nile virus. Prevention and control of communicable diseases. Communicable diseases can be prevented and controlled. Communicable disease control programs seek to reduce the prevalence of a disease to a level at which it no longer poses a major public health problem. Elimination focuses on removing the disease from a large geographical area, such as a country or region of the world. Eradicate eradication refers to irreversible termination of all transmission of infection by extermination of the infectious agents worldwide. Again, there are primary, secondary, and tertiary preventative measures. Agents of bioterrorism. The agents most likely to be employed as agents of bioterrorism are those having the potential for both high mortality and easy dissemination. Factors most likely result in major public panic and social disruption. 6 infectious agents are considered to be of major concern, and healthcare providers should become familiar with the epidemiology and illness patterns of these diseases. Agents of bioterrorism examples include anthrax, smallpox, and the plague. Vaccine-preventable diseases. Vaccines are one of the most effective methods of preventing and controlling communicable diseases. Many current diseases are controlled by vaccines but have not been eradicated. These include polio, diphtheria, pertussis, measles, rubella, and influenza. In the United States, the No Shots, No School legislation has resulted in the immunization of most children by the time they enter school. However, many infants and toddlers, the group most vulnerable to these potentially severe diseases, do not receive scheduled immunizations on time, despite the availability of free vaccines. Community and public health nurses play a major role in the effort to increase immunization coverage of infants and toddlers by checking the immunization status of each child at each encounter, organizing immunization outreach programs, and educating the parents and the public. Foodborne and waterborne diseases. The focus on foodborne illness has increased in recent years from publicity surrounding such incidents, especially those that have caused fatalities. Anyone can acquire a foodborne illness regardless of socioeconomic status, race, sex, age, occupation, education, area of residence. But some groups are more susceptible than others. Highly centralized food production and processing systems with widespread distribution networks increase the potential for contamination to result in a large-scale, multi-state outbreak. The rate of infection is highest among infants and small children. Outbreaks are common in restaurants, hospitals, nursing homes, and institutions for children. Improper food preparation temperatures and cross-contamination appear to be the biggest risk factors for food-associated outbreaks. Waterborne pathogens usually enter water supplies through animal or human fecal contamination and frequently cause enteric disease. Hepatitis A is the most well-known waterborne viral agent. Vector-borne diseases. Vector-borne diseases are transmitted by vectors, usually insects, either biologically or mechanically. The two most common in the United States are Lyme disease and Rocky Mountain spotted fever. Lyme disease, the most common vector-borne disease in the United States. Rocky Mountain spotted fever is transmitted via tick vector. The vector differs by the region of the country, and it mostly the Rocky Mountain spotted fever is most commonly seen in the southeast, Oklahoma, Kansas, and Missouri. Diseases of travelers. Individuals traveling outside the United States should consult with public health agencies or other knowledgeable sources to learn which diseases are prevalent and what precautions should be taken. Some of the common infectious diseases that can affect travelers are malaria, foodborne and waterborne diseases, and diarrheal diseases. Travelers and healthcare providers must be aware that travelers may return from trips to exotic places carrying an unplanned disease. It is important for providers to conduct a recent travel assessment. Likewise, refugees and immigrants may arrive with infectious disease problems. Malaria is caused by the blood-borne parasite and is potentially fatal disease characterized by regular cycles of fever and chills. Transmission is through the bite of an infected mosquito. Foodborne and waterborne diseases abroad can be avoided if the traveler eats thoroughly cooked foods prepared with reasonable hygiene. Diarrheal diseases, some of these cases of diarrhea do not have infectious causes and may be a result from stress, fatigue, schedule changing, and eating unfamiliar foods. Parasitic diseases are more prevalent in developing countries than in the United States because of the tropical climate in many of the countries and their often inadequate prevention and control measures. Several factors at present are leading to an increase in parasitic infections. The factors include international travel, immigration, an increase in AIDS, and recognition of how selected parasitic diseases are transmitted. Community and public health nurses play a key role in the prevention, diagnosis, and control of parasitic infection. Diagnosis of parasitic diseases is based on history of travel, characteristic clinical signs and symptoms, and use of laboratory tests. Hospital-acquired infections, previously referred to as nosocomial infections, are obtained during hospitalization or developed within a hospital setting. They may involve patients, healthcare workers, visitors, or anyone who has contact with the hospital. Invasive diagnostic and surgical procedures, broad-spectrum antibiotics, immunosuppressive drugs, along with the underlying illness, leave hospitalized patients particularly vulnerable to exposure to virulent infectious agents from other patients and hospital flora from healthcare staff. In this setting, the simple act of performing hand hygiene before approaching every patient becomes critical. Hospital-acquired infections have a high likelihood of involving and contributing to antibiotic resistance. The CDC maintains the National Nosocomial Infections Surveillance System. The infection control practitioners play a vital role in hospital infection surveillance and control programs. More than 95% are nurses. In 1985, in response to concerns about the transmission of HIV in healthcare settings, the CDC developed a strategy of universal precautions for blood and body fluids. This requires that blood and body fluids from all clients be handled as though infected with HIV or other blood-borne pathogens.